Okay, picture this. Two patients, both dying. There's only one ventilator left, and an algorithm. It makes the final call. Who lives and who dies?
And if you think this is some thought experiment, something out of a sci-fi movie, it's not. This is happening right now.
See, AI is already deep inside our hospitals. It's in the ER, triaging patients. It's in the ICU, managing beds, and it's assigning you a risk score, a number that could literally dictate the kind of care you get for the rest of your life.
And look, the whole idea behind this was amazing, right? We were promised something objective, unbiased, superhumanly fast, a system that could get rid of messy human error, get rid of our prejudices, and make these impossible decisions perfectly. But what happens when that machine starts learning our worst habits? And this is where it all goes wrong. It starts with something called the proxy trap. Now, that sounds technical, but trust me, it's a simple and fatal flaw in how the AI thinks. Okay, so here's the deal. How do you teach a computer what sickness is? I mean, it's complicated. It's messy, right? So the developers, well, they took a shortcut. They used something called a proxy, basically an easy-to-measure substitute. And in this case, that substitute was money. How much you cost the healthcare system.
Now, on paper, this kind of makes sense, right? If you're really sick, you probably need more treatments, more tests, which costs more money. So the AI's job was simple. Find the most expensive patients and get them into special high-risk care programs. The only problem? That's not how our world actually works.
And this quote from Ziad Obermeyer, one of the researchers who cracked this whole thing open, just nails it. Because of, and I'm quoting here, structural inequalities in our healthcare system, Black patients at the same level of sickness actually end up costing the system less than white patients. So the AI, just looking at the numbers, it draws this absolutely chilling conclusion. It sees lower costs and thinks it's looking at a healthier person.
And this is what that actually looks like in the real world. A huge study on a widely used algorithm found that a white patient and a Black patient could have the exact same risk score from the AI. But in reality, the white patient might have a moderate chronic illness, while the Black patient has multiple uncontrolled conditions. And yet, the white patient gets recommended for extra care, and the Black patient gets excluded.
So what did that mean in practice? The biased algorithm, it only flagged 17.7% of Black patients for these critical care programs.
But check this out. When the researchers fixed the bias, when they told the AI to look at actual sickness, not just cost, that number jumped to 46.5%. Think about that. The algorithm was missing more than half of the Black patients who desperately needed that extra help.
So this isn't just about some unfair piece of code. That proxy trap, that's just one piece of a much, much bigger problem. We're talking about code with real life-or-death consequences.
And it's not an isolated incident. Look at Arkansas. An algorithm cut in-home care for people with disabilities so badly that some ended up hospitalized. Or take sepsis. A tool used in over 170 hospitals failed to predict it in 2/3 of patients. Then there's the Medicare algorithm that was kicking elderly patients out of nursing home rehab way too soon, all based on some cold cost-cutting calculation. But what if the problem goes even deeper than that? I mean, what if the bias isn't just in the software? What if it's baked right into the hardware? What if the very tools gathering the data are already lying to the AI? You know that little clip they put on your finger at the hospital, the pulse oximeter? It works by shining light through your skin to measure oxygen. Simple, right? But here's the thing. It was designed and tested mostly on white skin. The result? It's 3 times more likely to miss dangerously low oxygen levels in Black patients. So now you have faulty data from the hardware feeding into biased software. It's bias on top of bias.
Okay, so we've got biased code and biased hardware. But what if the most dangerous part of this whole equation is actually us?
There's this psychological thing called automation bias. It's basically our built-in tendency to overtrust automated systems, to just assume the computer knows best, even when our own gut, our own expertise, is screaming that something is wrong.
And you can see exactly how this becomes a disaster. Step 1, the AI gives a bad diagnosis. Step 2, the doctor, who's probably overworked and swamped with information, sees the recommendation from the objective machine. Step 3, they doubt their own judgment and just go with it. And step 4, the patient gets harmed.
And just when you think it can't get any worse, it does.
Because so far, we've just been talking about bias from numbers, from cost data, from flawed sensors. But the new generation of AI is learning from something way more insidious. Us, our words, all the text ever written online. And it's learning to replicate our stereotypes.
A study out of Cedars-Sinai is just unbelievable. They gave an AI identical patient cases and only changed one thing, the patient's race. The results? For Black patients with depression, the AI suggested they be put under guardianship. For Black patients with ADHD, it recommended omitting medication. And for anxiety, it focused on potential alcohol use, just parroting back the worst kinds of stereotypes it found in its data.
And this isn't just happening in one country. As these algorithms get exported all over the world, it's becoming a kind of digital contagion. We're spreading these biased models of care on a global scale.
Just look at the pattern. In the US, the problem is using cost as a proxy for health. In India, a health app requires a smartphone, so it locks out the rural poor. In the UK, skin cancer AI trained on light skin misses melanoma in people of color. In Brazil, an algorithm trained on city data fails to spot epidemics in the countryside. The specific bias changes, but the result is always the same. The most vulnerable people get hurt.
So, after seeing all this, what's the final diagnosis? What's the real root cause of this sickness in our technology? And here's the most chilling part of this whole story. The AI is not broken. It's not malfunctioning. It's actually working perfectly. It's doing exactly what we built it to do, learn from our world. It's holding up a perfect, unflinching mirror to our data, our decisions, and our deeply unequal society. So you see, the problem isn't the machine, it's us. And as these systems get smarter, as they weave themselves deeper into our lives, the real question we're left with is, what has it learned from us?